Action.
Hello everyone, welcome to this virtual session of Expecting Baby from the Halifax and Region Military Family Resource Center. My name is Lauren Conrad. I've been volunteering with the MFRC for the past year and I'm a registered nurse at the IWK. Before we get started, I do want to mention that I'm not representing the IWK or the opinions and positions of the IWK during this presentation. And in this week's session, we're going to talk about infant attachment, recognizing infant cues, as well as how to soothe a baby, diapering, and swaddling. First things first, congratulations. Welcoming a new baby into your lives is exciting, and hopefully this presentation helps you to learn more about how your baby will develop attachment and how to recognize their cues in order to meet their needs. So what is attachment? Sometimes the terms attachment and bonding are used interchangeably, but they're not the same thing. Bonding is about your feelings of love and your sense of connection with your baby, while attachment is about the relationship between you and your baby and the emotional connection your baby feels towards you. This develops over the first few months after birth. The relationship between a parent and baby is the first relationship that a baby has in its life, and it's very important. Infants form attachments through strong relationships with responsive, caring people who are consistently available to them. So basically, attachment develops as caregivers respond to the basic needs of their baby. The picture on this slide explains this pretty well. At the top of the picture on the left, and the start of the attachment cycle, the baby has a need. Let's say this need is food. So the baby is hungry. The baby cries to let the caregiver know they're hungry. The caregiver then recognizes that their baby is hungry and feeds them. This fosters trust between the baby and the caregiver because the baby knows that their needs are being met. The key to the development of this trust is a consistent meeting of their needs. The baby needs to know that they can anticipate having their needs met each time. But sometimes it's difficult to tell what the baby needs at any given time. So later in this presentation, I'm going to talk about how to recognize certain cues from your baby, which will allow you to know if they're hungry, upset, happy, or tired. So why is attachment important? Attachment to a caregiver provides a sense of safety for the infant, which will allow them to feel comfortable exploring their environment. It's also the foundation for lifelong emotional health. Babies learn how to organize their feelings by looking to their caregiver, and it also allows them to handle situations as they grow older, such as going to school, playing with others, and developing self-control and trust in others. So there are 4 different types of attachments that infants can create: secure, avoidant, resistant or ambivalent, and disorganized. And I'm going to briefly explain what each of these mean. So the first one is a secure attachment. This is the ideal attachment style for infants. An infant who has a secure attachment uses their caregiver as a base to explore their environment. So if a baby is in a new environment, such as a friend's home, they will begin to explore the environment and periodically look to their caregiver for reassurance that they are safe, because the baby trusts their caregiver. Like I mentioned earlier, this trust is built when the caregiver responds consistently to the infant's needs. With a secure attachment, the baby will also protest when the caregiver leaves, such as when they're left with a babysitter or at daycare, and they will want to be with the caregiver when they return. This type of attachment is the most common. An infant with a resistant or ambivalent attachment is extremely wary of strangers, beyond the typical stranger anxiety that you would see in infants. They will become very distressed when the caregiver leaves, but they're not particularly comforted or reassured when they return. A resistant attachment looks like an infant clinging to their caregiver, but then resisting the closeness, kind of like the picture on the left. The baby is close to the caregiver, but is kind of putting an arm up and pushing them away to kind of resist that closeness. They might also reject the comfort from caregivers or display aggression. And this type of attachment is relatively uncommon and can develop from inconsistency from the caregiver. An infant with an avoidant attachment avoids their caregiver as well as strangers. The baby has no preference between their caregiver and a complete stranger. The baby doesn't believe that their needs will be met. In this type of attachment, caregivers are typically disengaged or distant with the baby. This type of attachment is uncommon. So the baby has no preference between a caregiver and a complete stranger because their needs aren't being met on a consistent basis. They believe that they have an equal opportunity to have their needs met with their caregiver or with a complete stranger. An infant with a disorganized attachment shows no clear type of attachment behaviors. So these are infants that don't really fit into any of the previous 3 attachment styles that I've described. The infant can seem confused or apprehensive in the presence of their caregivers. This type of attachment usually develops if the caregiver displays extreme or erratic behavior towards the infant. So the infant has no way of knowing if their needs will be met or not. There's no clear pattern of their needs are not being met, their needs are being met. It's just completely random. And this type of attachment is quite uncommon. So how do you know if your baby is developing a secure attachment? There are some early signs that you can look for that a secure attachment is forming. By 4 weeks old, babies will respond to their caregiver's smile with a facial expression or a movement. By 3 months old, they'll smile back at you. By age 4 to 6 months, they'll turn to their caregiver and expect a response if they're upset. This is because that trust has been developed already, and they can turn to the caregiver and expect an appropriate response if they're upset because they have had their needs met on a consistent basis for their entire life. And by age 7 to 8 months, they may also start to respond to their caregiver's emotions, such as anger, sadness, and stress. Now we're going to move on and talk about how to recognize some infant cues. I'm going to talk about how to recognize when your baby is hungry, full, tired, engaged and ready to play, and disengaged and needing a break. These cues are especially important for ages 0 to 6 months, because after age 6 months, your baby will be able to communicate and interact in additional ways that can allow you to know their needs. So we'll start with recognizing hunger cues first. Some hunger cues that you can look for are if your baby starts to wake up and stir, they'll move around, stretch a little bit. They'll also open their mouth and turn their head. This is called rooting, and they do this because they're turning their head to look for the breast or the bottle. They'll also start sucking on their fingers or their hands, smacking their lips. They'll clench their fists, and their arms and legs will be bent in towards their body. So if we go back to the previous slide for a second, the picture on the right is what a hungry baby would look like. So this baby is sucking on their fingers, their fists are clenched, and they have their arms and legs bent in towards their body. I'll just go back to the other slide. And crying is a late hunger cue. So if you're able to recognize the earlier hunger cues that I've described, you can kind of prevent them from getting to the stage where they start to cry. If they do start to cry, then you have to stop and soothe the baby first before you feed them, because they might be too upset to actually start feeding. All right, now we'll talk about what a baby looks like when they're full and they're done feeding. A baby who's full will look nice and relaxed. So they'll slow down and stop sucking and release the breast or the bottle. Their body will be relaxed, so the bent arms and legs that we saw in a hungry baby, we're going to see their legs and arms stretch out, and they'll be relaxed. They'll also open their fists, like the picture on the right here shows. So on the left, we have a hungry baby with a clenched fist, and on the right, we have a full baby with a nice, relaxed, open hand. They might also fall asleep at the breast or the bottle or soon after they're finished feeding. Now we'll move on to recognizing sleep cues. How do you know if your baby is tired? They'll start to stare off into the distance and avert their eyes from the caregiver or an object, whatever they're interacting with. They'll start to yawn, maybe have some jerky movements or arch their back. They're going to lose interest in toys or people. They'll start to frown, clench their fists, and they might also seem fussy and start to rub their eyes or their ears. Now we'll move on to engagement cues. So these cues are a baby telling you that they want to play with you, they want to interact with you. So your baby's eyes will look wide and bright, kind of like the picture on the right. They'll also make eye contact with you, smile, they'll reach their hands towards you, turn their head towards you. They might also babble or make sounds. When your baby is showing you these signs that they want to interact, this is an opportunity to promote building trust and a secure attachment. Smiling back at your baby and responding to their babbling by talking to them or mimicking the sounds that they're making promotes trust, because the baby will know that they can expect an appropriate response from you. If they learn that they can expect you to smile back at them when they smile at you, they'll also learn that when they have a need like hunger, you're also going to respond appropriately and meet that need. You smiling back at them is called mirroring, and that is a way of you showing baby that you're understanding that they're making an effort to communicate with you, and then you're going to communicate back with them. A little tip is when interacting with your baby, for the first 3 months, the best distance for baby to see your face in focus is 22 centimeters away from your face. So you want to hold them nice and close to your face and support their head, like the picture on the left. And babies actually prefer to look at faces rather than objects. So after some interaction and play, babies become overstimulated and they need a little break from activity. This doesn't necessarily mean that they'll be tired and want to nap. Some babies will, but they just need a change of pace and activity for a period of time. Some signs that your baby is disengaged and needs a little break are frowning, turning their head away, squirming or kicking, hiccuping, turning red in the face, wrinkling their forehead. They might also put a hand up and push things away. And your baby will let you know when they're ready to interact and play again by showing you those engagement cues that we just went over. So as you can see in the picture on the right, this baby looks very disengaged. They're not staring at the object or their caregiver. They're looking away. They're kind of frowning. They want nothing to do with the puppet. So that's a sign that this baby needs a little bit of a break, and they'll let you know if they're tired or if they want to engage and play again. So before we talk about diapering and swaddling, I do want to just talk about soothing a baby quickly. So I mentioned earlier that crying is a late cue for hunger and a lot of other things, but babies are still going to cry at times. So it's important to know some tips about how to soothe a baby. Sometimes people wonder if they should let their baby cry for a little while because they don't want to be spoiled. They don't want the baby to be spoiled. I hear this all the time. Babies can self-soothe, and if they do, it's usually very quickly. Most people don't realize that if a baby is going to soothe themselves, they should only really take 15 seconds to do so. So that's pretty quick. So if they cry longer than about 15 seconds, that probably means that the baby needs a little bit of help from their caregiver to calm down. That doesn't mean you need to, put a timer on for 15 seconds, but it's just something to be aware of, that babies will need help to calm down often, and it doesn't hurt them for you to help them do so. Babies are still trying to figure out how to cope, how to regulate their emotions. So helping them soothe themselves is definitely very helpful for them. So some ways that you can help soothe your baby are swaddling, which I'm going to talk about in a few minutes. Another is swinging motions, such as being in a caregiver's arms, rocking, going on a car ride, dancing around, being in a stroller. The swinging motions mimic what babies felt in the womb, because every step or movement that the mother makes during the pregnancy creates a swinging feeling for the baby, and they find this really comforting. So if you can mimic that outside of the womb by doing rocking, dancing, car rides, etc., then this can be an effective way to soothe your baby. Another way to soothe is with shushing sounds. So these sounds also mimic the environment in the womb, because babies hear shushing or whooshing sounds made by the blood flow in the womb. So shushing noises, white noise machines, or CDs. Some people will even put on their vacuum cleaner or a hair dryer as well. And these can also be very effective ways to soothe baby. Sucking is also a way that babies are soothed, and this can be done with a soother, a finger, breastfeeding, bottle feeding. And one last way to soothe baby is in a side stomach position. Babies like lying on their side or their stomach more than they do their back. So you can hold your baby in your arms and they can be laying on their stomach or their side, or you can hold them over your shoulder. You just have to make sure that if you're going to place your baby down for a nap, that you place them down on their back again. All right, so we'll move on to diapering and swaddling. So I'm going to start with how to change a diaper. I'm going to stick with how to change a disposable diaper because I've never changed a cloth diaper, but I know there are lots of great resources online about how to fold cloth diapers properly if you do choose to use cloth diapers. But some of these steps are still the same anyway. So the first thing you want to do is gather your supplies. So you'll need a diaper, wipes or a cloth, and lotion or diaper cream if you choose. You want to gather your supplies first so that you don't leave the baby unattended, especially as they start to roll over. If you have other children, this is a great opportunity to get them involved so they can help pass you supplies, they can get you diapers if you want, and it helps them feel involved with the new baby. Next, you'll want to lay your baby down on their back and remove their clothes. Undo the soiled diaper. You can place a cloth over the baby to prevent any accidents, especially for boys. They only have to pee at you one time for you not to forget that again. Then you'll clean the area from front to back, making sure to clean really well in the skin folds. You'll gently lift their legs to remove the soiled diaper and slide in a clean one. Sometimes the back of the diaper will have a marking on it, and it will have the wings attached to it so that you can tell which side is the front and which is the back. Then you can apply lotion or diaper cream if they have a bit of diaper rash. Then you can pull the front of the diaper through the legs, hold it to the baby's stomach, and then take down the wings. To see if the diaper is too tight or too loose, make sure you can slide 2 fingers in the top of the diaper. And a question some people might have is how often you should change a baby's diaper. For the first few months of their lives, babies will pee about 20 times a day. So that would be a lot of diaper changes, and it can get quite expensive if you're using that many diapers per day. So a good rule of thumb to follow is you should change your baby's diaper about every 2 to 3 hours. If they poop, you should change them soon afterwards because stool is acidic and it can irritate their skin, but it isn't necessary to wake a baby up to change their diaper. If they're having a nap and you notice that they've pooped, you can wait until they wake up and then you can change their diaper as soon as they wake up. A couple of helpful tips for diaper changes. You can fold down the front of the diaper so that it won't irritate the umbilical cord while it's healing. And as your baby gets older, you can give them something to hold and play with while you're changing them to distract them so they're not squirming around too much. And another topic that expecting parents like to hear about is swaddling. If you aren't sure what swaddling means, it's basically wrapping your baby tightly in a blanket or a wrap of some sort. There is a bit of controversy surrounding swaddling due to safety issues, but if you swaddle safely, it's an effective way to soothe your baby, and it promotes sleep. Babies like to be swaddled because it resembles being in the womb, being tight, having something tight around them, it's nice and warm, and it's constant contact around their whole body. So I'm going to discuss the safety issues and practices around swaddling first, and then I'll describe how to swaddle a baby. So 3 major safety concerns with swaddling are hyperthermia, hip dysplasia, and SIDS. Hyperthermia basically means overheating. This can happen if a baby is bundled up too much. So if you swaddle with a big fuzzy blanket, especially during the summer months, we're getting into those now, this can be easily prevented by swaddling with a lightweight blanket and keeping your baby's head uncovered. The next one is hip dysplasia. So this is when the hip joint isn't aligned properly or is partially or fully dislocated. So that would mean that the top of the thigh bone isn't aligned properly with the hip, or it's not even attached to the hip at all. This can happen if babies are swaddled too tightly and their legs are straightened and pushed together. So if we look at the picture on the left, this baby is swaddled with their legs pushed together, their hips and their legs are straight. This isn't a natural position for babies, and you shouldn't swaddle like this. You should wrap tightly around their torso, but the blanket or wrap that you use to swaddle should allow for movement of the legs and the hips, and the legs should be slightly bent. So if we look at the picture on the right, this baby is swaddled with lots of extra space near their legs. Their legs and hips are bent in a natural position, and they have lots of room to kick around or move their legs if they want to. And the next safety concern is SIDS, or sudden infant death syndrome. This is the unexplained death of a seemingly healthy baby less than a year old, usually during sleep. So the risk of SIDS increases with swaddling because the baby could roll over and obstruct their airway and potentially suffocate. So babies should always be placed on their back to sleep, and it's recommended to stop swaddling at around 2 months of age, and it's not necessarily recommended to swaddle a baby for sleep. If you do choose to swaddle your baby for sleep, stop swaddling for sleep at around 2 months of age, because even if they can't completely roll over onto their stomach, if they do try to roll over onto their side, depending on the positioning of their neck, they could potentially obstruct their airway. Another thing to note is just to make sure that their nose and mouth is uncovered and that the wrap isn't tight around their neck or anything like that. Some alternatives to swaddling that people use are sleep sacks and wearable blankets. So now I'll just describe how to swaddle a baby. The picture on the slide, I think, explains it pretty well, so I'm just going to follow it. First, you're going to want to lay a blanket down. You want the blanket kind of in a diamond orientation, and then you're going to fold down the top corner. You're going to lay your baby on top of the blanket and make sure their head is above the corner. So if you see the middle top, step 2, the baby's neck is kind of aligned with the top of the blanket. So the blanket's not going to be up too far on their neck or covering their mouth. You can start folding on either side, but I'm just going to follow what the picture says, so I'll start on the left side. You're going to want to straighten their left arm and then place it so it's down by their left side. Then you're going to take the blanket on that same side, put it over the baby's body, and then tuck it underneath the right side of the body, underneath their right arm. And you're going to do the same thing on the right side. Straighten their right arm, place it down by their right side, and then take that side of the blanket and then tuck it underneath their left side. For the bottom of the blanket, you can just loosely fold up the bottom, and then you can tuck it under one side of the baby, just making sure that it's not too tight and they have lots of room to move their legs and that their legs are in a nice natural bent position. You also just want to make sure that the blanket isn't tight around the neck or up too far to cover the nose or mouth. You can check the tightness of the blanket around the chest by making sure you can slip your hand between the blanket and the baby's chest. And if your baby is resisting being swaddled, don't try to force it, because some babies love to be swaddled and some do not. Thank you for listening to this presentation. I hope it provided you with helpful information as you anticipate your new arrival. If you have any questions about anything from the presentation, you can contact me and I will be happy to answer your questions or find the answer for you if I don't know it. Thank you again, and congratulations, everyone.